Substance use and abuse is a growing problem in the Philippines. According to the International Narcotics Control Board or INCB, an international drug monitoring agency, the Philippines is listed as one of the countries in Southeast Asia where drug trafficking is growing numbers. In the year 2004, an estimate of 6.7 million drug users in the Philippines was recorded. By the Dangerous Drugs Board, the 2008 National Household Survey on the nature and extent of drug abuse in the Philippines conducted by the same agency revealed that there is a downward trend in the number of drugs users, down to 1.7 million users. The decline may be associated with the government's intense effort in combating drugs. The following are the reasons for the successful decline of drug abuse in the country. Operations conducted by the different law enforcing agencies like the Philippine National Police or PNP, National Bureau of Investigation or NBI, Philippine Drug Enforcement Agency or PDEA, Bureau of Customs and other law enforcers have helped arrest local international drug syndicate members, traffickers, and destroy secret laboratories and warehouses. Implementation of policies under the Dangerous Drug Act of 2002, like the compulsory drug test for application of driver's license, entrance to military service application for firearms licensing, and others. Actualization of the Dangerous Drugs Board programs and projects in partnership with other agencies like the Department of Education or DepEd, Department of Social Welfare and Development or DSWD, and other local government units or LGU, and non-government organizations.
And protective factors of using drugs. The use, misuse, and abuse of drugs are the result of various factors surrounding a person. These factors either increase or decrease the possibility of a person to use drugs. Risk factors are those influences which increase the chances of using, misusing, and abusing drugs. Protective factors, on the other hand, are those influences which decrease the chance of using, misusing, and abusing drugs. Risk and protective factors affect people in 5 domains or settings. 1. Personal. Early aggressive behavior versus self-control. Risk and protective factors affect people in 5 domains or settings. 1. Personal. Early aggressive behavior versus self-control. As a person grows, there are risk factors that can influence or affect that person's drug taking. Here are some examples. Use of drugs at an early age, risk-taking behavior, childhood problems, feelings of isolation. There are also protective factors that can decrease the chances of drug taking. Here are some examples. Self-control behavior, good reasoning skills, positive interaction with people, sense of belonging.
Number 2. Family. Weak parental guidance versus strong parental guidance. The examples of protective factors are good communication, positive family relation, clear and consistent family rules, and strong family values. The risk factors are this interaction with each other, poor family values and ties, history and patterns of drug use. Number 3. Peers and friends. Substance abuse versus academic excellence. Examples of risk factors are preference to stay with peers and friends than family. 2. Association with peers and friends known to use getaway drugs like cigarettes and alcohol. The examples of protective factors are 1. Promotion of friendships. 2. Reliance on friends for emotional support. And 3. Inviting friends at home to know the family. Number 4. Schools. Availability of drugs versus strong anti-drug policies. The risk factors are poor academic performance, lack of commitment to studies, and involvement in fights and conflicts. The protective factors are good to excellent academic performance, joins extracurricular activities and school organization, and show interest in attending classes.
Five, community. Poverty versus strong community relationship. In our community, there are also risk factors that can influence or drug abuse. For example, easy access to gateway drugs, poor community organization and neighborhood relationship, poor implementation of community laws. But there are also protective factors that can reduce the chance of drug taking. For example, strong community relationship, active and positive community programs, strong community advocacy against drug use. 5. Community. Poverty
The sixth classification of drugs. First, we have gateway drugs, such as cigarettes and alcohol. This is a legal drugs that a non-drug user might try, which can lead them to more dangerous drugs such as marijuana and shabu. Second, we have depressant drugs, such as alcohol, barbiturates, and tranquilizers. It slows down a person's central nervous system. Doctors prescribe this to help a person to be less angry, less stressed, or tense. It relaxes muscles and nerves. It also makes patients feel sleepy and lightheaded. Third, we have stimulant drugs, such as amphetamines, shabu, caffeine, nicotine, and cocaine. It speeds up a person's central nervous system, have the opposite effects of depressants. It makes a person's energy high. The negative effects are depression and tiredness. Fourth, we have narcotics, such as cocaine, heroin, and marijuana. It relieves pain and induces sleepiness. It is also used in medicine. It is administered in moderation to patients with mental disorder. This drug is illicit. And fifth, we have hallucinogens, from the word hallucination, such as lysergic acid diethylamide. It distorts reality and facts. It affects all senses. It makes a person see, hear, and feel things that don't exist. Inhalants. Household products used as inhalants include acetone, rugby or solvent, spray paint, cleaning fluids, and air conditioner fluids. It is found in ordinary household chemical products and anesthetics. Intoxication is similar to the signs of chemicals sniffed, inhaled, or huffed. Continuous use or abuse leads to delusions, brain damage, liver damage, coma, or even death.